And you have Mrs. Oyebola. Thank you for coming. Yeah.
Nurses Way of School of Post-Basic Psychiatry, Federal Neuropsychiatry Hospital. Please, let's give ourselves a round of applause. We want to appreciate God Almighty for the privilege. This is the ninth edition. We could not celebrate last year like because of COVID-19, but this year, and our team is role of mental health nurse on the menace of depression and suicide among Nigerian youth. That is our team. Without wasting our time, we want to officially declare the program open. Also, we are still expecting some head of department. We are expecting Dr. Oluwani will join us briefly, head of clinical services. Also, we are expecting the HOD nurse services, Mrs. Oluwa, will join us too. Without wasting our time, we want the medical director to help us to officially declare the ninth nurses week open. Let's give him a round of applause. Thank you, sir.
Thank you so much. The director of admin, Psychiatric Yaba, the active principal at the School of Nursing, School of Basic Nursing, Psychiatric Hospital, Yaba. The chairman of the student nurses, I don't know whether it's the union, right? Then the important person present the senior nurses, senior officials from the hospital, the civil service and gentlemen. I want to especially welcome you to this occasion, the ninth Civil Nurses Week of the School of Basic Psychiatric Nursing of Federal Psychiatric Hospital, Lagos. With this morning, this morning. This is my first official assignment in your midst. Yaba, Lagos. As I said earlier, I especially am very welcome you to this institution. I normally refer to this hospital as the mental health hub of Nigeria. You are privileged to be trained in this institution. And that is why on daily basis you can see some innovation. And I can see that you people are IT compliant because most of these programs, it seems as if it's being live, probably on Facebook or on Zoom. So I really appreciate you for this innovation. I want you to clap for yourself. Of your program for this nurses week, which is depression, being a very important mental health challenge, is of paramount importance for everybody to take note that depression is so common and is debilitating in nature, and every effort geared towards the prevention and the treatment is worthwhile. Therefore, as student nurses of this great institution, I want to enjoin you to pay particular attention to your training, to acquire knowledge and knowledge in this institution, because most of the things we do, they are open-based. And I want to encourage you to acquire as much as possible so that we'll be able to function anywhere in the whole world. Most of the nurses who come from this institution, they are working in UK, in the US, and in Australia. And I want you to also make sure you make best use of your time and training for the benefit of mankind. At this point, I want to thank the student nurses Gabi, who has invited me. And on behalf of the members of staff and board and personnel from this hospital, I declare this nurses week open.
Please, we have to permit us to do. We are expecting visitors from House Committee on Health institutions. They are on their way from Federal Medical Center, and we are actually preparing them. But you agree with me that the medical director felt this is an important meeting, and that's why we're here to just let the program open. And at the same time, I want to wish you successful nurses.
Thank you very much, sir. Also, in the same vein, the activities continue to Friday. We'll be happy you can join us dinner party on Friday night, sir. It will be so lovely. We'll be so much happy to welcome you, sir. Thank you very much, sir.
Great mercies. The chairman of the occasion, the medical director, Dr. Weye, head of clinical services, Dr. Ubani, director of administration, Mr. Aliyika Anchi, HOD Muslim, this is the pioneer principals of the school, Mrs. Jumakek, the guest speaker, all HOD present, all consultants, psychiatric present, all nurse educators, the students and the guest present. I want to welcome everyone to the 9th Student Nurses Week of this great institution. First and foremost, I thank God for keeping us alive to witness today. On behalf of the school and the students, our appreciation goes to Chairman of the occasion, Dr. Weye, and our gratitude goes to the management of Federal Psychiatric Hospital Yaba for their support. I wholeheartedly appreciate our amiable, dedicated, intelligent, and hardworking educators for their roles in imparting knowledge, training, and discipline from the students in ensuring they become best in Nigeria and the world at large. Also, I appreciation goes to the nursing department for their support, for supportive roles and training imparted on the students. I also appreciate the non-teaching staff of the school support working as a team towards the achievements of the school. Thank you all. May God continue to be with you all. Amen. The theme of this year event is the role of mental health nurse on the menace of depression and suicide among Nigerian youth. First, depression. Depression is a pathological disturbance running towards the sadness and depression. It is commonest mental illness, hospital admission. As all know, there's one that have depression. At the end of the day, the person needs to be admitted because of the kind of the situation and the kind of the problem the person is facing. What about the causes? Where are methodological factors that are the causes of depression? One, hereditary. Hereditary incidence in the general population, 1% in identical twins, 96% in siblings, 23% in half siblings. Biochemistry. Theory will be due to decrease concentration of monoamine and reception side of the brain. And we have social factors, children from broken homes, social class, high social class, psychological stress, pressure at work, physical stress, infection, loss of loved ones, divorce, unemployment, and many more. When we look at the causes of depression, we can find that maybe someone is because of loss of loved ones, it may be husband or wife or brother. Maybe someone that is maybe the one that is monitoring the program, and at the end of the day, the person just suddenly thinking that who's going to be by the sense of making fun for me? Or maybe the husband, you have been doing well, you have been doing those things, nobody knows what is going on between you and your husband, or between you and your wife. And suddenly that just person does die. And if care is not taken, there's no real proper counseling. A counselor to counsel that person at that moment, the person will go into what? Into depression. Maybe when we are talking about the positive depression at work, maybe find yourself maybe the environment is not conducive. Maybe the person you are working work environment. A work is scoring, and so the following they say, you come and work another day, you come and work another day. I got that this guy is not taking the person is right. There's a lot of trust there, a lot of person depression. The other thing is that someone needs to be very, very careful and take life so seriously. To make you happy, make yourself happy. Like you are. Why? Even your immediate family, environment, when you look at this country nowadays, you can't find it. Everybody just get down. And that's what we can do. So to just take it, take life easy. I want to. If I start my children, I don't know what to do. Maybe I just make it for but I'm not saying anything. You see, I know that I don't 5,000 naira. Maybe you will just in my value. Now, this is like, I'm going to get 5,000 naira. I don't know anybody. So what about the type of pressure? heterogeneous, we have information. So what about the clinical signs and the clinical manifestations that stand as depression? Unreality. Loss of weight, constipation, patients feel frightened and feeling restless. As the future in this type of depression is the apprehension and the anxiety leading to mass agitation. Having depression, I think the need to associate yourself with it. It's not what it's not the society. Maybe it's not what it's not straight on. Maybe what you think is that if I'm looking for a gig, I'm doing business. I started business with 1 million naira, and at the end of the day, I'm still looking at money. I don't know, thinking maybe that and said the head of the development of the man, it's not the end of his life. That I think continue. So that's part of the signs and symptoms of depression. How can we manage this patient? One, in the first patient, observation and management of the skilled tolerant staff. Then the patient at the end of the day, the patient is in the hospital, and the person that's going to take care of the patient was the person that's highly skilled and intolerant. Because that's the patient, the exercise patient. So, number two, treat physical and mental. It's the best by patient with moderately stimulating environment. That is, place patients with others to avoid being in isolation. You know, at least when patients are on mission, call the patient, let him know that let him feel free with other patients. You know, let the patient see this one, come together, express your feelings. Don't allow the patient to stay alone. You know, for someone that's staying at home, for maybe complete a month, nobody to relate with anything. When you say, what do you think? This is my mind. This is something. This is someone that's maybe that's never come to that. At the end of the day, the only one that we think nobody's going to, nobody's no assistant, no friend. Before you know what is going on, condition will become close. Okay. The third one, introduce the patient to group. Gradually close observations. This side always be on the road out for a sudden change in outlook and behavior. When these patients, you need the patient needs totally monitoring. You need close monitoring. So at the end of the day, you need to inform the patient in daily activities. Like give the patient newspaper, let him read and read newspaper. Take it, or come and meet with other patients, let them go together, do any other thing. So there are good therapy, the patient, there are good therapy. Why? You know this place, you like it, from there, like it can be expressed. He was not feeling, he was passing through. It's not too bad. Take classes, go to yourself. When there is that there is hope, before you know what is going on, the patient started coming out gradually. Then we do group therapy. You call the patient and brother, especially everybody will share their feeling, they share their experience. You know what I'm passing through. Your home is not up to my home. They take that stories from there, family, go to therapy, call the family and the patient. What is it? You must see this patient as your important person in your family. Before outside of this problem, this patient is doing fine because of this condition. Don't let them feel rejected in your family. because two people, so you have to call the ability to use ourselves, to the family, to the community, and to the nation at all and school. The other one, build up a good relationship, show patients that you are sympathetic. And then the time has enough. It's part of our duty, it's part of our job to make sure we create environment for our patients. For the patients now, and you know, I know you are ready today. I want to tell you something. Tell me, not to she or she will be able to express herself. That is the time for that. Now, you know, I was telling you, you know, that the way as you know, what about our part of my own in the hospital? I have to be patient. That is to encourage patients to live and bring drugs, antidepressants, then tranquilizer, sedative, for example, all those things. And as you live in the patient, you have a dietary, let patients eat. Patient needs time for come and I know my stomach, there's nothing I do. No. I can't eat anything like I do. I don't think nobody's going to take it. Nobody, just take it little by little. Little by little. I think we're going to have fun. From very what is going on, until you have your last one, psychotherapy, individual growth therapy has said it. Therapy is very important. It's kind of information that makes the patient to psychotherapy, taking medicine, participating in daily activities, including in road, it's part of treatment. One patient is other patients that go together, they are related together. From there, it will be gradually come around. So that is it. How can we define this condition? How can we define depression in our society? One, there is no sure way to define depression, but you can not. There is no way because people are treated as well. There is no way because people are substitution of country. Someone that has been working for before. At the end of the day, just everyone will give us later. Because it's cannot be and we have airline, they have children. It's not to pay the school fees, it's not to pay the house rent, it's not there's a lot of activities that have been doing before. People will be coming at the end of the day. Cannot be able to perform is our role in his family. You know, if that person does need someone to counsel her, where the person go and so it's very important. Let's find ways to have strength and improve your self-esteem. We must make sure that we find a way to have this strength. Whatever you are doing, what I want to ask you, great time to relax yourself and take life so simple. I understand if I wear I appreciate you. If I have, you need to appreciate yourself. You need to appreciate. What we say about always appreciate yourself. When you appreciate yourself, don't like the appreciate, that's our purpose. But when you need to appreciate yourself, you don't say, don't appreciate yourself. And try to discover yourself. When you discover yourself, don't do more than yourself. That's also, I used to tell my husband, this is what I have. But I was doing this one as I don't know. When you reach market, just as one bricks, and we have one back home. So when you come back, all those people, that's what I go to eat. I've got money inside the market. You know, at least I said, madam, know how to plan with this money. We need to understand ourselves. You don't understand ourselves, you don't know what's going on. The problem will come. As far as that problem, depression is a great problem. Please, we need to appreciate ourselves and don't let more than our capacity. The next one, then, good care of yourself, enough sleep, eat well, and exercise regularly. At least, make sure that you are doing exercise. Exercise back on feet. Yourself. Yes, at least 8 hourly in a day. But who can, somebody can afford 8 hours sleep nowadays. Someone has been close for work, maybe someone has been close for work, maybe now, you know, honestly, we cannot even maintain our sleeping for 8 hours. They don't take great time. They might say 20 minutes or an hour. Just to relax yourself. Then, next one, reach out to family and friends when time gets out. Don't keep yourself. Just keep your family. I said, with you, how's work, how's this, how's that, friends, how's that, friends, move around, be yourself. There are some people say no to self, there are some no to others, no to others, no to self. Like me, I'm going to say no to self, I know what I'm passing through. I think everybody knows what I'm passing through. You understand what I'm saying? No to self, no to others. They are not to others, no to self. Something is wrong with me, something is wrong with me. I said, what happened to you? I said, no, maybe too, I don't even discover myself. That is actually true story. Not to others, not to self. Not to self, not to others. Please, let us be very careful. Because now regular catch up and see your provider, see your provider. Yes, we are going to fit something. Yes, we are going to come from mission and not out from our doctors. We can have any doctors. We can have any take your plan and make everything. As prescribed, drugs regularly. After the patient about to discharge, you go to family. Please, as I very well, make sure your patient is taking this drug very well. There's some, after the patient being discharged from the hospital, they say, you guys are going to go to they want somewhere else to use the money and after the plan value to a different drugs, you got bank transfer and pharmacy. Sometimes drugs, you got bank transfer and pharmacy. There's something that another problem with sex. I just have family. That's why the family needs to be cancelled. Another one, street therapy section. Let the doctors know what is and it is not working for you. You know that you are taking some as a patient. I tell your patient that this drug that I'm taking you, there is problem. I'm not feeling fine just because of what? It may seem like this make you feel better, but they can actually make it harder to treat your depression. You know that some people have one problem. I know that I'm asking you. After you and wake up, that's the way to be the go back. You see, go back. The only thing is that try to discover yourself and that problem as you are express of feelings. Gradually, you will be. Even someone you know someone, please, and this is not going to pay your money. Just please, I will pay you gradually. Not because of that, I want to do advice gradually. What is happening to me? What happened to me? What is the effect that there's a lot of problem. Trying to fight stress like medication and yoga. Not more. Don't like big life decision on a day when you are feeling down. Talk to your therapist or doctors about the medicine. Stop depression for coming back. This is a very, very important. The sanitary nurses and the dealing with patients, they are the first contact in the hospital. When patients come to the hospital for the first time, the patient is going to see the nurse from duty. Nurse, please, I go to you. If the patient do on the admission, who is not going to proceed? Stay with the patient, senior nurses. The center try to do and place and leave the rest for God. At the end of the day, which will be happy that God are going to do it. Thank you.
Let us appreciate thank you. We want to appreciate because we are seeing Gabi, Gabi, please let us do a round of applause. For people that don't hear the gathering and watch this program live, so couple of them, thank you for advertising us. Thank you. There's before I recognize the individual, she has, sorry, ma'am, because she has been here as 9 years. Why she went up with the first so I'm very sorry, ma'am. Sorry for that stress, ma'am. So in our presence this morning, we have the end of nursing service. The person of Mrs. Olubola Eko. Thank you very much, ma'am. Thank you very much, ma'am, for coming. So without wasting our time to just give us the welcome so brief, so some of our responsibilities as we know in tackling the question. Very good. Thank you very much, ma'am.
No, that's after the speech. After the speech. I've invited you.
Recognize the principal of School of Cooperative Mental Health Nursing, Yaba as well, Mr. Ojedogu, the staff of Cooperative Mental Health Nursing, Yaba, the students, invited guests, and my DDNS president, Mr. Yaba. I recognize everyone at here this morning. I'm so impressed
Yeah, I'm in the Zoom.
to have come across these topics. Depression and suicide. The principal has said a lot about it, but I think I have few things to add.
So
You can see that depression leads to suicide, whether attempted suicide or whichever way. Because we have the attempted one, that is why it's suicide itself. And suicide is being taken from the Latin word suicide. Suicide takes about 10 position in the cause of deaths in Nigeria. And we need to know about it as mental health. And who are the mental health nurses? Mental health nurses are professionals that have been trained for the job. They are psychiatric nurses. That's why we call us mental health nurses. So the role of mental health nurses, I'm trying to form my own topic. The role of mental health nurses in forming the relief of depression and suicide. I've already told you that suicide, because we have dealt well with the topic. I've already told you that suicide. Once the patient is at the extreme end, it doesn't have any other thing than to leave this world. He's fed up, he's overwhelmed. And the next thing for him to do to avert all these problems that he's passing through is death. Why am I living? Why am I living? Is it not better for me to leave this world and for others to continue to enjoy? Because it's not like it's disturbing others. By the time they leave, others will have their own. That's why they are making campaign against suicide. They always say no to suicide. It's not only mental health nurses that are helping community, individual, as well as governments. They have those to pay. Yes. Our parents as well. Most of us that are parents, and we are fond of dancing our children. They are not improving. They are not doing well. That are you only one? drugs. No. And in junior subjects, we shouldn't forget, as a mental health nurse, our responsibilities towards suicidal patients. To search the patient's back nearly every 2 days. That's why they always tell us that no injurious objects stay in the patient's custody, including shirts, belts, pin. You must keep it away, keep them away from the reach of the patients. And allow other nurses on the watch to know about the patient. That make it a secret. You can as well write on the chart of the patient so that when they are serving drugs, you know that this is a VIP on the watch. Because it's a dry physical case. And we watch, we monitor the warning signs. Some of them, they used to exhibit these warning signs that we don't even take care. We don't even take note of. Warning signs. Some may say it, and some patients may not even say it out. That is worse. In a subtle manner, you can see the patients coming to you on and off, agitating. You need to attend to the patients. Don't say, Mama, I don't know. I mean, the patient has something in mind to tell you, and which is critical at that time. Don't know whether is that instinct that is pushing the patient wants. Patient may say, I'm fed up. Even if it doesn't come to you, you may confide in another patient that I'm even fed up. This life is progress. Don't take it on a just like that. You know that there is something happening. Or the patient may even tell you that he has got a gun. And what is gun being used for? Is it not for killing? Don't just say which gun. What are you saying and what are you talking about? It's giving you, it's talking sense. And it's better for you when you are sharp objects. That's why you don't give sharp objects like you blade. Nail cutter is better. Don't allow patients to get in touch with you. Or you can even call an attendant to do it for the patient. That will be better. And the patient will be very close to you. So in that case, we should manage our patients very well. And we say no to suicide. Even in the community, we create awareness in the community. Allow the patients to come closer to you. You try and counsel the patient. It doesn't work for you to take your life. There was a time that I came across one of the patient's husband that lost his wife. Patient said he wanted to go and commit suicide. I said, what for? You don't need it. When you commit suicide, you will neither here or there. It's better for you. She has gone to rest. It's better for you to wait the night and take care of the children that the wife has left behind. And she actually cooperated. And at the end of it all, I made him to see the reasons why we should do that life continues. You can even introduce him to make him realize that this life continues. That's what I want. Doesn't need to take his life. What for? It's a sin. Talk to the patient as if you are talking to your sister or your brother for him to get it right. And aside from that, the sleep pattern of the patient is too much to be monitored. I just want to make it snappy because the time is common on my side. Sleep pattern of the patient to watch it. Intermittent sleep, intermittent wakes. Know that something is disturbing the patient. And you don't allow patients to hold drugs because they are fond of that, overdosing of drugs and lead to suicide. You don't combine morning, afternoon, evening drug at once because the patient has not taken it in the morning. You know is if patient is sleeping, right sleep is good. The patient refuse right sleep. If patient refuse right refused, don't combine works for the patient. That is, you too you want to help the patient to commit suicide, and which will not be just. So another thing which I want to bring to our notice is that when we accompany patients to the time, ensure, because suicidal patients will refuse to eat. You know, patients refuse to eat. It will lead to another thing. Patient can collapse and die. Check the vital signs of the patient's regularly. Ensure that the patient is. You don't go to the dining hall with the patient. Don't accompany the patient to the dining hall. Are you creating another forum that the patient? Some patients they sell out their food, they give out their food. It's one of the responsibilities as a mental health nurse. And even when visitor comes, allow the visitor to take part of the food because they too can add to suicide if they don't want the patients at home any longer. So we don't need to be careless about that. Please let us do our work very well. So because what I normally tell other colleagues is that you and I we are going to account for whatever thing we have done on this set. What are they going to say about you? What are they going to say about me when we are seeing the service? And even the community, anybody that you recognize as a suicide person, please work on the patient. Don't ignore the patient. And don't create any assault on the patient. Even drugs, even all these are alcohol. Don't allow the storage at home because it can lead to suicide. Anything can lead to suicide. And even hanging ropes, they are not allowed. Even fans, patient can roll his cloth on the fan going to commit suicide. At night, we should be very, very observant. You should not go and sleep at night. When you are too on duty, ensure that you monitor the patient. Both of you should not go together and sleep because the patient, the suicidal patient, keeps watch on you. He will not tell you because they are hallucinates. The words that they are hearing, you tell them that you are committing suicide. He doesn't want it. What are you doing here? Please and please let us perform our responsibilities and report any case on the work. If the patient has come to tell you this is what I'm experiencing, don't take it as a joke because it's one of the warning signs of society. Tell the senior nurse. Don't discuss the matter of the patient because they are individual entity. Or else will not hear any other thing from the patient, and the patient may as well commit suicide because you have really exposed the patient. That is why you need to appreciate them every time and don't isolate the patient. By the time you say, Mama, you like me, or you keep on nagging on the patient, the patient will not come to you, you try and about you. Please let us play our role very well, and God will help us. So global awareness too. That's on the side of the government. Seminars, workshops, go for retreats as well, in order to make people to know that there is a statement that says no to suicide. No to suicide. Let us say it. No to suicide. God will help us in Jesus' name. I wish you a happy celebration.
Yaba is let's welcome the guest for brief elaboration.
I want to say thank you for organizing this very important conference. I was so excited when I had the opportunity that the program has improved now, especially among our youth. Not like our HOD person said, my HOD person said, many are going to depression. But then what is depression? Because the adult has said what about depression. But I want to tell you that after you go to church, when they're teaching on the school, always study the 4 memory something very important. And what is the memory value of depression and suicide? The memory value of suicide is that, oh, the past has been miserable. The past has been miserable. The present is unbearable. And the future is unpredictable. What next? Let me go to the next. Look at what I'm trying to say. The past has been miserable. The present is unbearable. And the future is not, cannot be predicted. Let me go beyond that memory value. And we shouldn't allow it to happen in our time if we can keep on what nature us to say. And religiously, such a thing will not happen. Basically, there are two types of depression of suicide. One is actual suicide, which is very difficult to commit. The other one just the suicide is attempt to kill others, while the actual suicide is attempt to kill itself. But because of the love of self, nobody wants to kill himself. But a mentally ill patient may be attempted to kill himself during the missing period of illness, which you may get to know later. So I'm happy for the topic and they are very much on it. But I want to say that suicidal tendency and actual attempt is very rampant. And you, being an ambassador of mental health, can go on and spread the good news that say no to suicide. If you do so, you are now become a good ambassador of mental health. That's what I pray for you, and I'd like to come to pass our life.
Very much, sir. We recognize to our lecturers. The next speaker is welcome. Mr. Apola, thank you very much. So we're having our first lecture now by Gabi Williams at Alzheimer Foundation. Thank you. Let's get my eyes together, please. Thank you, sir.
I am standing on the protocols. My name is Olani Peter. I'm the senior officer of Gabi Williams Alzheimer Foundation. Principal, sir. In absentia, the medical director. Dr. A.O. the HO, teaching staffs, and the entire students and community of this great institution. Gabi Williams Alzheimer Foundation is an NGO that is in the promotion of mental health and awareness in Nigeria. Gabi Williams Alzheimer Foundation was initiated of late Professor Gabi Williams, who was a sufferer of Alzheimer's disease. Alzheimer's disease is a mental health situation. The mental health illness is a sort of dementia, which is one of the leading mental challenges globally, as ascribed by WHO and Alzheimer's Disease International. Gabi Williams Alzheimer's Foundation has come to play a major role in awareness, education, promotion of mental health, capacity building, and institutional capacity. And part of our project is to partner with training institutions to ensure that we have manpower who are specifically trained to become mental health specialists in Alzheimer's disease and dementia altogether. We've had a relationship with Federal Ministry of Health existing, Alzheimer's International existing, and other various institutions who have been our partners. our work cuts across individuals, groups, and donors who have been supporting our agency. I will not want to talk too much. At this junction, I want to acknowledge our resource persons who are not in Nigeria, personally in the US. They've been online since 8 o'clock. And you know, these people, they work with time and they've been waiting for us. But unfortunately, we are having technical challenges. You can see us battling with what we have. So they've been on and off. And so the Williams Alzheimer Foundation, as I said, we are all the human history of cardiology, and we have with federal and state agencies. And working with you, we believe is a starting point for us to come over and make sure that we come up with general awareness program. At this point, I want to acknowledge my immediate boss, Executive Director of Gabi Williams Alzheimer Foundation, Ms. Olato Gabi Williams, who will be speaking to us from UK. Just give me 2 minutes or a minute. Let's just confirm from the ICT. If she has been online since 8 o'clock. And the other person, Balaji Boshi, for you can see it. She has also been online since 8 o'clock. So just give us. All right, sorry. Let me just chat her off that she should unmute.
Hello? Can everybody hear me? Hello?
All right, that's my immediate boss, the MD. She's the trustee of Gabi Williams Alzheimer Foundation and she's head of administration and logistics. Ms. Olato Gabi Williams is the first daughter of the Professor Gabi Williams. She is the director of Selena Venture. She is also one of the board of trustees of UNSDG International African Chapter. We want to connect our audio with the phone we have. Sorry, we are not in our normal office. We are in our normal venue. Unfortunately, we are visitors there and some different things. All right, Emily, you can go on, please. We are live.
Dr. O.A. Owoye, CMD, Federal Neuropsychiatric Hospital. I stand on all existing protocols. Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. Good to be here with you all at the esteemed School of Post-Basic Psychiatric and Mental Health Nursing. I'm sorry about the technical hitches we're having, and I really do hope you can hear me. I'm going to just have a quick word with my IT assistant and find out what the status of the audio is at your end at the School of Post-Basic Psychiatric and Mental Health Nursing. It is good to join you in this recognition of Student Nurse Week, in a program which seeks to foreground the role of the mental health nurse in the management of depression and suicide among Nigerian youth. Who do I have to convince that mental health is of universal importance? Who amongst us is unaware that mental illness, depression, and suicide are a global public health crisis that tragically encompass all ages? One moment, please. Can they hear me? Can they hear me? Can they hear me? Okay, fantastic. Okay. Okay. I've just confirmed that the audio is working well. So I'll start again, if I may. Good morning, ladies and gentlemen. Good to be with you here at the esteemed School of Post-Basic Psychiatric and Mental Health Nursing. It is good to join you in this recognition of Student Nurse Week, in a program which seeks to foreground the role of the mental health nurse in the management of depression and suicide among Nigerian youth. Who do I have to convince that mental health is of universal importance? Who amongst us is unaware that mental illness, depression, and suicide are a global public health crisis that tragically encompass all ages? Who has not read the newspaper headlines indicating a startling rise in youth suicides in our nation? These are evil days needing urgent interventions. I would like to introduce my short paper with a quote from an alarming article published in the renowned The Lancet, the global health journal. The article is entitled, "The Time is Now: Reforming Nigeria's Outdated Mental Health Laws." Let me quote, "Nigeria currently faces a global human rights emergency in mental health, underpinned by poor societal attitudes towards mental illness and inadequate resources, facilities, and mental health staff. Figures suggest that approximately 80% of individuals with serious mental health needs in Nigeria cannot access care. With fewer than 300 psychiatrists for a population of more than 200 million, most of whom are based in urban areas, and in view of poor knowledge of mental disorders at the primary healthcare level, caring for people with mental illness is typically left to family members. A paucity of community-based and primary healthcare services means that access to care is restricted to the most severe cases, usually in the form of psychiatric inpatient care or makeshift institutions. The result is chronically and dangerously under-resourced mental health system catering to the needs of an estimated 1 in 8 Nigerian people who suffer from mental illness, poor awareness of the causes of mental health, widespread stigma and discrimination, poorly equipped services, and abuse of people with mental health problems. A reform of the mental health law that is in keeping with international standards is urgently needed to drive change. I have just quoted from the article published in The Lancet, the renowned global health journal. And the article is entitled, "The Time is Now, Reforming Nigeria's Outdated Mental Health Laws." I was relieved, therefore, to learn of Lagos State government's work in the context of mental health and suicide prevention. That the state government has established functioning helplines, that they are looking towards the domestication of the existing mental health policy for healthcare delivery. And they are looking towards pushing for the mental health bill to be passed. And I'm happy to see that with this seminar hosted by the School of Post-Basic Psychiatric and Mental Health Nursing, that a federal government-owned tertiary institution is responding to the urgency of the moment. My name is Olaton Gabi Williams. I'm a trustee of the Gabi Williams Alzheimer's Foundation, which seeks not only to create awareness about Alzheimer's disease, but to strengthen the available infrastructure for the prevention and management of AD. A quick recapitulation of the disease. Alzheimer's is an irreversible, progressive brain disorder that leads to loss of memory and the degeneration of thinking skills. By the 7th stage, which is the final stage of the Alzheimer's journey, the sufferer cannot, the afflicted person cannot even carry out the simplest tasks, cannot walk, cannot eat, cannot swallow properly, or sleep properly. In our advocacy work around Alzheimer's, which is a form of dementia, we center the role of the nurse. I am not here to center Alzheimer's disease. This is a forum dedicated to suicide prevention and depression in youth in our nation. And if it seems that I am centering Alzheimer's, it is only so that I can highlight the centrality of mental health in the disease and encourage more nurses to view their role in mental health as of critical importance. Without the body of knowledge which specialization brings, how can you recognize and intervene effectively in mental health related suffering? Sufferers of Alzheimer's disease, like the youth afflicted with depression, like those at risk of suicide foregrounded in this program, have serious battles with mental illness. At GWAF, we have begun to vigorously advocate for not only an increase in the general nursing workforce, but for an increase in the mental health workforce. With more nurses in the field, there is more help for Alzheimer's sufferers in their fight to keep at bay mental illness, even as they lose the fight with memory and cognition. I want to repeat the quote, a little of the quote from The Lancet. 80% of serious sufferers of mental illness, 80% of them cannot access mental health care. We have currently approximately 300 psychiatrists in a population of 200 million. To call nurses to action in the area of mental health is the purpose of GWAF's participation in this program. Professor Olajide Gabi Williams is a professor of neurology at Columbia University and board secretary of Gabi Williams Alzheimer's Foundation. We have brought with us a video in which Jide will give us an overview of the mental health implications of Alzheimer's disease, which is a progressive form of dementia. Over to the IT team now for the video, explaining the mental health implications of Alzheimer's disease.
Neuropsychiatric problems with Alzheimer's disease is very challenging. And it is important for us to recognize the manifestations of these different behavioral problems that occur in patients with Alzheimer's disease. Aggression and anger is one that we frequently see. Aggression can be caused by many factors, including physical discomfort. It could also be triggered by environmental factors and poor communication. A patient with Alzheimer's disease may become suspicious of those around them and even delusional, accusing others of infidelity and theft and improper behavior. And these delusions can be quite severe and require medication when it becomes severe. There's a syndrome called Capgras syndrome, which is a delusion or an irrational belief that someone they know or recognize has been replaced by an imposter. They often accuse a spouse of being an imposter of their actual spouse. Anxiety can be severe in patients with Alzheimer's disease, and this can trigger significant agitation. Patients might develop anxiety during changes in environment, such as when they are hospitalized or when house guests are present or when there are changes in their environment. And they can develop fear and fatigue resulting from trying to make sense out of a world that has suddenly become very confusing. Delusions may also be accompanied by hallucinations, and the hallucinations can be quite severe, requiring antipsychotic medications. Finally, Alzheimer's disease patients can also develop severe depression. They could lose interests, become socially isolated, have difficulty concentrating, become very withdrawn, and have significant impairment in their thinking. And then sleep problems are also seen. They could wake up disoriented, and as the disease progresses, they might begin to sleep during the day and awaken frequently throughout the night. And so, in summary, these neuropsychiatric manifestations of Alzheimer's disease are very severe. They can be very severe, and they can require medications and psychiatric treatment, often by a healthcare professional with expertise in this area.
Thank you very much to Professor Jide Gabi Williams for that overview of the mental health implications of Alzheimer's disease. The global action against dementia was initiated in 2015 by the World Health Organization at the first WHO Ministerial Conference. The call for action was adopted by more than 160 representatives, including 80 UN member states. Held at the WHO headquarters in Geneva, the conference focused on the reduction of dementia's burden globally in the next 10 years. I learned of the top 10 overall research priorities in the prioritization exercise conducted by the WHO, 6 focused on prevention, identification, and the reduction of dementia risk. The delivery and quality of care for people with dementia and their caregivers, formal and informal, informal being family members, close friends, concerned people in the patient's life. This delivery and quality of care was also identified as a research priority. With this in mind, on September the 11th, 2021, at the 4th annual memorial lecture of Gabi Williams Alzheimer's Foundation, we invited Bola Oshikonlu, an experienced occupational therapist and GWAF Advisory Council member, to speak to us. At that program, she provided tools with which to significantly improve communication between patients and their caregivers. You heard Professor Gabi Williams talking about the importance of effective communication. When communication is poor, mental health is threatened. Mental health requires the human touch, which here prioritizes skills for effective empathetic communication that nurses can intentionally bring to delivery of mental health services, all health services. Gabi Williams Alzheimer's Foundation joins the WHO to call for a recognition of the high priority that should be given to psychosocial research into models of care in the community and across the course of the disease, including late and end-of-life care. The WHO's call highlights the emphasis that needs to be placed on behavioral and psychological symptoms of dementia. The WHO's call highlights education, training, and support for the formal and informal caregivers and the health and social workforce. The WHO's call also highlights, amongst the multifaceted interventions, the necessity of electronic health and mobile health technologies for people with dementia. And I think this clearly applies to people in all realms of the healthcare systems. Patients and sufferers will increasingly benefit from access to electronic health and mobile health technologies. GWAF shares the views expressed in the famous medical journal I have already cited, The Lancet, that we should not overemphasize the need to find a cure for Alzheimer's disease at the expense of our commitment to the improvement of today's care provision. We must not overemphasize the need to find a cure for AD at the expense of our commitment to the improvement of the quality of the patient's life. The quality of care. The improvement required in the quality of the life of sufferers of mental illness in our nation, whether they are young or elderly, will require an expanded workforce of committed mental health nurses, bringing the human touch, bringing informed skilled support and consistency in health care delivery. To say we need an expanded workforce is an understatement, given the statistics I already cited from the Lancet. 300 psychiatrists for a population of 200 million. That 80% of sufferers of mental illness do not access care. Ladies and gentlemen of the School of Post-Basic Psychiatric and Mental Health Nursing, GWAF is committed to strengthening the available infrastructure for AD and dementia care. the available infrastructure for sufferers of illness all over our nation. And we're here today to foreground mental health illness. We therefore seize this forum to advocate for sustained and informed mental health care for the youth of our nation to access not only now, but throughout the course of their lifetimes. We join the WHO's global call for action and the call for global action in mental health, identified key areas for intervention in our Nigerian communities. Continuous advocacy, awareness building, awareness creation in mental health. Adoption of intergenerational dementia and mental health awareness and advocacy campaigns. Intergenerational advocacy. Curriculum development on dementia and mental health by educational policy institutions. Expanded care programs with emphasis on gerontology and mental health. Student research in dementia and mental health issues, including traditional remedies for the same. Volunteer programs in elder care homes and facilities for the elderly. Volunteer programs in youth rehabilitation centers, in established healthcare institutions. Special training program for skills acquisition and mental health evaluation. Special corporate programs for skills acquisition in the reduction of workplace stresses. I close on a note of hope for the mental health workforce, those already in the field and those considering its prospects. If passed, the Mental Health and Substance Abuse Bill will allow for much needed budgetary allocations for mental health facilities and mental health providers. And at GWAF, we long for the time, and the time is now, when mental health services will be a covered mandate in the National Health Insurance Scheme to ensure accessibility and affordability of care. Thank you very much. Thank you. Over to my colleague and member of the GWAF Advisory Council, Bola Joko Oshikonlu, to deliver her presentation.
Good morning. Thank you so much for joining me. My name is Bolaji Kwashikolo. I'm an occupational therapist, and today we're going to be talking about healthcare professionals. Healthcare professionals are the people we go to when we have challenges with our health. At the end of this conversation, what I want us to do is I want us to be able to know who the doctor is, who the nurse is, who the allied health care professional is, who the social worker is, and who the paraprofessional is. So, who is the first person we meet? Who is the first person we talk to when we have a disease process? The primary care doctor is a physician or medical practitioner, somebody who has gone to school to learn how to become a doctor. This professional is concerned with promoting, maintaining, or restoring health through the study, diagnosis, prognosis, and treatment of disease, injury, and other physical and mental impairments. Doctors, medical doctors, we have the MD, who is the doctor of medicine, and that person usually will diagnose and treat human disease. So they're treating that disease. On the other hand, we have the D, who has a holistic approach to treating disease. He's not or she's not just looking at that disease, they're looking at the entirety of that patient. And not just the symptoms, but what could be causing that. After the doctors have done their first degree, then they could go on and specialize. And what I have done is I've referred to them as consultants. So our consultants consist of psychiatrists, neurologists, psychologists, neuropsychologists, geriatricians, dentists, and ophthalmologists. Consultants are doctors who have had a specific area. If you need to see a consultant, most of the time what you will do is you'll make arrangements with your primary care doctor and will refer you to that physician. So who is a psychiatrist? A psychiatrist is a person who specializes in the assessment and treatment of mental and emotional health disorders. It includes mood changes, emotional outbursts, agitation, hallucination, delusion, impulsivity, aggression, and inappropriate behavior. Who is the neurologist? The neurologist is a person who specializes in system. The neurologist should not be confused with a neurosurgeon who is the expert when it comes to operating on the nervous system. Then we have psychologists who The neuropsychologist is trained to evaluate cognitive disorders. They'll perform comprehensive evaluations using reliable and standardized tests. A neuropsychologist will assess the severity of issues that are going on, figure out the causes and symptoms, and will measure progress and decline over time when it comes to that disease. The dentist is also a medical professional who does oral medicine. It's a branch of medicine that studies, diagnoses, and works on prevention and treatment of disease, disorders, and conditions of the oral cavity. Excuse me. The ophthalmologist is also a medical professional who focuses on the eyes and vision and all that. When a person has mental challenges, mental illness, vision is impacted sometimes because of the drug that is used. Sometimes the oral cavity is also impacted because of the drug that is used, the drug interaction. Sometimes some medications will cause the person to just store saliva. So sometimes you just want to see it. You need to see a dentist, ophthalmologist. In some instances, patients will have double vision. So that's where you're going to see your ophthalmologist. Let's go to our nurses. Who are our nurses? These are the people we see more often than we'll see the medical doctors or the consultants. The nurses help us within that healthcare system. They are usually considered the project managers. We're now going to talk, we have bedside nurses, we have clinical nurses, we have community nurses. For this, we're going to focus on the community nurses because the community health nurses work to improve the health and the well-being of people within a community. They serve in educating them about illness and disease. So when you talk about community illness, it's also preventative and it's also helping to with the disease and process and how to deal with those disease processes. The community mental health nurse, because we're talking about mental health and going to be further into this, works within the framework of the treatment team. So when we talk about the team, we're talking about the doctor, we're talking about the nurse, we're also talking about allied health professions and paraprofessionals. So they provide nursing services to individuals diagnosed with mental illness and their caretakers, caregivers, care partners, and families. They may visit individuals in the homes to identify factors in the social, psychological, psychosocial, physical environment, and may contribute to the individual's disability. They make recommendations for emergency or continuing care. They suggest alternative treatment plans, teach caretakers and family members methods of dealing with emergencies. They provide advice on the availability of medical, social, and housing facilities for individuals in the community. They link people with agencies like GWAF. They would intervene in crisis situations and administer emergency treatment, engage in treatment modalities such as health teaching, individual and group psychotherapy, family therapy, and a vast milieu of therapies that are appropriate, and have referrals for OT, PT, speech. They work with appropriate agencies as necessary, as I mentioned, GWAF. They ensure coordinated team treatment plans, so they ensure that there's a treatment plan for the individual. They supervise and care for paraprofessionals and professional personnel in the community so that mental health care is addressed. The allied professional is that healthcare professional that is not a medical doctor, a nurse, a physician assistant, or a dentist. So we have the optometrist, we have the audiologist, we have dietitians. So let's go first. Let's see the optometrist. The optometrist is an eye care professional who provides service related to the eyes or vision. The audiologist is a professional who diagnoses and treats hearing and balance problems. The dietitian is a professional that helps with feeding and nutrition. We'll find that a lot of people who have mental health difficulties have challenges when it comes to food. Sometimes you'll see some patients get overweight due to the medicine that they're taking. The dietitian would help with the kinds of food that that person has to take. Sometimes there are people who just don't want to eat. So in order to have nutritious meals, the dietitian will come in play and help. Then there's the occupational therapist. The occupational specializes in improving the patient's ability to communicate and perform self-care activities. In addition to providing that, the occupational therapist can also work with a speech therapist and work on cognitive rehabilitation therapy. The occupational therapist works on assessing home safety, suggesting environmental modifications to increase safety, planning activities to facilitate the care of the cognitively impaired person. The physical therapist works on gait difficulties, balance problems, recovery from injury or surgery, and planning physical activity programs for an individual, giving that person special tasks to perform. Usually we'll find out that some patients who have mental illness have difficulty with their gait, and some of them also have challenges because of medication side effects. The speech therapist is a person who helps the cognitively impaired person or the mentally impaired person to communicate. They help them to improve their ability to express their needs, even when they can't find the right words. As I mentioned before, they also help with cognitive rehabilitation therapy by providing structured exercises and trying to work on remediating difficulties with the mental challenges that that person has. The pharmacist is that person who provides pharmaceutical care, aiming to achieve proper and safe use of medication. And they're the ones who will tell you what the side effect of any drug is, or what the drug interaction would be like if you take two different drugs, or if you take a drug and you have certain food, they'll tell you no, you cannot have this medication and eat this. You cannot have a certain medication and have grapefruit. So that's where the pharmacist comes in. The recreation therapist specializes in using creative healing methods to help people with mental illness or any kind of disease process. The music therapist is a clinician that uses clinical evidence-based music as an intervention to promote an individual's goal and develop therapeutic healing for that person. So who is our social worker? The social worker is a person who helps people to solve and cope with problems in their everyday life. Social workers work in different places. They work in hospitals, they work in schools, they work in clinics, they work within the community. They are the case managers, and they're professionals that help to establish and also relay things that have to be done between the nurse and also the paraprofessionals and the allied professionals. Then who are the paraprofessionals? Paraprofessionals are healthcare workers that handle routine tasks in patient care. It includes work like providing minor first aid, conducting tasks that have to be done on a daily basis for a patient. They frequently provide self-care. For instance, helping patients to bathe, helping them to eat, making sure the patients are comfortable, taking patients for a walk, and also helping them to get dressed. So when we talk about self-care, so you see the paraprofessionals will work with the social worker, with the allied health worker, with the nurse. They have contact with those people. We find that a lot of paraprofessionals do not have direct contact with the doctor except if they go with the patient to the doctor's office. So in summary, what have we talked about? We've talked about the different professions, and it's just been a nutshell. We've talked about the nurse, we've talked about the doctor, we've talked about allied health professionals, we've talked about social care workers and paraprofessionals. If you have any questions, do not hesitate to contact us. Have a great day.
So much, for that. We sincerely appreciate you, your commitment, your effort, and everything you have done for this foundation so far. Ola Oshikolu is an occupational therapist based in the US. She's one of our faculty and shall be supporting us in every application. Time, I will want to round up. MD, please permit me to round up at this junction because there are other activities to be done. I want to end with, to wrap up from your end, but please grant me the permission to round up from this meeting. Gabi Williams and Alliance Foundation sincerely appreciate you and the time and the opportunity. We want to appreciate the CMD, Dr. A. Uweye, is medical director of this great institution. We also want to appreciate the principal of this institution, Mr. Ojedoku. Thank you so much for the opportunity. We want to appreciate the HOD person, Mrs. Oge Obufua. I wish she's on seat so that we can push forward our objective of inculcating and incorporating dementia into the curriculum of the school and ensure that we have specialists, students who become specialists in not only gerontology, but dementia as an aspect of mental health. It's a global pandemic, it's a global challenge, and WHO and every force, they are looking onto it, and I think it's a field we want to venture into. The president of the student, I want to appreciate you, Mr. Oriola, most importantly, not the least. Thank you so much for the opportunity to be part of this program. I just stumbled on him and he welcomed us to be part of this program. The entire staff, we also appreciate you. I was told from reliable source that some people are on duty, they are clinical, what have you. That's why they have to excuse us. So we pardon them, they are still on course. Great message. Great message. Great message. As you celebrate this year, message week, put in your mind what will be my contribution to the society. And as you strive to answer that question, I pray that God will continue to see you through, strengthen you, and grant you success in every area of your individual. As Alliance Foundation, we are open to partnership, we are open to friendship, we are open to volunteers, we are open to research, we are open to engagement in various aspects. And as I said earlier, you can get our contact online. And I'm also happy to tell you that this event, this session we have done is available on YouTube. It's available on YouTube. We've already shared the link, and some people are already watching it on YouTube to be a reference to your friends and even yourself. So thank you so much for the opportunity, and we do best in this evening.
Thank you very much for hosting the Gabi Williams Alzheimer's Foundation. And thank you to our distinguished faculty, Bolajoko Oshikonlu, occupational therapist. Thank you to the School of Post-Basic Psychiatric and Mental Health Nursing. Thank you.